We turn to 5 on your health tonight. We were just talking about this before the break. A scary new setback for Pope Francis. His doctors say that he suffered a bronchial spasm in the hospital and inhaled vomit. Joining us right now is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. The Pope, as you know, Dr. T, has been hospitalized with pneumonia in both lungs for 2 weeks now. One day he does better and he's eating, and then the next day we hear he's having kidney trouble. How serious is this latest report?
This is very serious. He already had double pneumonia. He aspirated, which means he was vomiting, and some of that got into the lungs. They had to do non-invasive ventilation. That's essentially, think of it like the CPAP machine, you know, that mask.
Yeah.
And it's really the last resort before you're intubated, before you put on mechanical ventilation. Sometimes it can work, often, to prevent people from getting ventilated, but this was a tough day for him.
Tough day for him, indeed. So we have a lot to talk about. So let's start with the HPV vaccine. You just got some new results of a study looking at it at its effectiveness. What does it show?
This is really exciting. This is a study done by the CDC. It was published in the MMWR today, and what it showed was that Gardasil, which is the HPV vaccine, it's recommended for boys and girls at age 11 and 12. This study looked at basically women between the ages of 20 and 24 and followed them from between 2008 and 2022. What they saw was that over this 14-year period, there was an 80% reduction in cervical precancers. And precancers are basically what comes right before cervical cancer. Other studies have shown that this vaccine reduces cervical cancer significantly. The bottom line is this HPV vaccine is paving the way for a future free of cervical cancer, but more young girls and women have to go and get the Gardasil.
Important reminder. All right, we're also learning more about the risk when people do not get vaccinated. Well, let's take a look at some new numbers from the state of Texas that show 146 cases, 20 hospitalized, and as we have reported, 1 death. Nearly all are unvaccinated, including the child who died. So, in your professional opinion, what needs to happen now to get this situation under control?
So just a reminder about measles, the most contagious infectious disease. What does that mean? That means in a susceptible population, 90% of people exposed will become infected. I'll say one other thing. If I have measles right now and I'm coughing or sneezing, not only can I infect any susceptible people in this entire room.
It's not just me, because I'm feet away, but in the room.
Correct, in the room. But remember, when I leave, it hangs in the air for 2 more hours.
Oh, it does.
So that's the issue. And then what's happening in Western Texas is you have an under-vaccinated community. And that's the issue, because what we're seeing right now is the spread is really only in the children that are unvaccinated. So, or have maybe received 1 vaccine. But the vaccine is so powerful, and that's the reason that we're not seeing more widespread, spread of measles across the country. What I can say is the measles vaccine is so effective that, unfortunately, most of us, even physicians who are in their 50s or younger, have never seen a case. So when you don't see measles around, and there's a lot of disinformation around there, you can think that the vaccine is more dangerous than the illness. What Western Texas is showing us, that's not the case. Measles is still dangerous. We had our first death in 10 years from measles in Texas. So really, I just want to implore parents to try to vaccinate their children.
Dr. T, thanks for coming in. Great to see you.
Good to see you.
Have a good weekend.